My name is Abby Bejo. Good evening, everyone. And I am the program director and founder here at Lake Health and Wellbeing. And I'm absolutely delighted to welcome you to the St. Kitts and Nevis launch of Come In A This, a radio drama series developed by the Heart Foundation of Jamaica. But before I proceed and get into the event, I would just like to recognize a few people. So firstly, I'd like to recognize the Honorable Iselin Phillip, the Junior Minister for Youth Empowerment and Social Development, Gender Affairs, Aging and Disabilities, Dr. Marissa Carty, the NCD Program Coordinator at the Ministry of Health, Dr. Simone Spence, the Director of Health Promotion and Protection, the Ministry of Health and Wellness in Jamaica. Unfortunately, she couldn't be with us today, but she did send her best wishes. I would also like to recognize Barbara McGaw, the Project Manager at the Global Health Advocacy Project for the Heart Foundation of Jamaica, Morrish-Cooke, the Communications Officer at the Heart Foundation of Jamaica, representatives from the Global Health Advocacy Incubator, our media colleagues, and all of us that have joined today. Thank you so much for joining us. So I'm just going to give you a little bit of background. So as an NGO, our main focus is on non-communicable diseases, or NCDs, which are the major public health challenge facing St. Kitts and Nevis and the region. Data has shown that 58% of deaths in St. Kitts and Nevis are due to NCDs, so we must take action to improve the health of our nation so that we can all thrive. As such, we have been working on the prevention and control of NCDs through a number of approaches. This event today is part of our You're Sweet Enough project, which focuses on reducing the public's consumption of sugar-sweetened beverages, SSBs, through educating the public about the health harms of SSBs and by advocating for the development and implementation of effective evidence-based SSB policies to ensure that our government is intentional about creating a healthy food environment. Through our You're Sweet Enough project, we engage the public and policymakers in a variety of ways. And today, the launch of Come In A This showcases a fun and engaging way to stimulate discussion on non-communicable diseases and the ways in which we can all tackle these conditions. Come In A This is a 13-episode radio drama geared towards helping the public make better choices individually and at a community level. During each episode, listeners follow the story of Angie and Jen as they embark on a journey through the curves and turns that come with having to make health and lifestyle choices. Come In A This was conceptualized and developed by the Heart Foundation of Jamaica's Global Health Advocacy Project as part of their food policy program and was first launched in Jamaica in 2021. We are very pleased to have partnered with the Heart Foundation of Jamaica to bring this radio series to St. Kitts and Nevis because regional collaboration is very important as we work towards the prevention and control of NCDs. This is because across the Caribbean, we are facing common health challenges, including the high rates of NCDs. And by partnering, we can amplify key messages, avoid duplication of effort, and be more efficient in our approaches. And that can only improve our response to NCDs. Also, partnering on combating NCDs in this way supports two sustainable development goals, that is SDG 3, to improve health and well-being, and SDG 17, developing strong partnerships and cooperation to ensure the SDGs are achieved. So we're very excited today about this launch. So today in this very short event, we'll hear from Dr. Marissa Carty, who's the NCD Program Coordinator at the Ministry of Health. And Dr. Carty will set the scene for us and provide us with some background information on NCDs in St. Kitts and Nevis. And then we'll hear from Morrish-Cooke, the Communications Officer at the Heart Foundation of Jamaica. And then following this, we'll give you the opportunity to hear the first episode of Come In A This, and then we'll open up for some questions. So without further ado, it's my pleasure to introduce Dr. Carty, the NCD Program Coordinator at the Ministry of Health, to provide some brief remarks. So over to you, Dr. Carty.
Pleasant good evening to everyone. Please allow me to adopt the protocol already established. It is a pleasure to represent the St. Kitts and Nevis Ministry of Health at this important, relevant, and timely launch of this dramatic radio series that covers a number of health issues, including non-communicable diseases. In the Caribbean, non-communicable diseases represent the leading cause of morbidity and mortality. Compared to other sub-regions of the Americas, people in the Caribbean between the ages of 30 and 70 have the highest likelihood of dying prematurely from NCDs. In the Federation of St. Kitts and Nevis, NCDs account for over 80% of all illnesses and death. Our national health data reveals that 5 of the 6 leading causes of death were from NCDs, with cancers representing the leading cause, followed by stroke and complications of diabetes. A survey of NCD risk factors found that 75% of adults carried excess weight. This includes overweight as well as obesity, with a hypertension prevalence of 36% in the same group. Evidence also showed that unhealthy lifestyles started in childhood and continued into adulthood. National school surveys showed that 15% of our children were obese, and that there was a prevalence of tobacco smoking at 10% among our youth. To strengthen national capacity to prevent and treat non-communicable diseases, the Ministry of Health established the Nct Program, which is governed by 3 principles, namely prevention, early detection, and management. The program is also guided by the 3-pronged mission to reduce the burden of NCDs in the country by promoting healthy lifestyles, reduce the prevalence of common risk factors, and provide integrated evidence-based treatment options to those diagnosed with NCDs in the most cost-effective way. To fulfill this mission, the Nct Program developed programs and activities not only aimed at educating the public about healthy lifestyle practices, but also to provide opportunities for the public to actively participate in these healthy practices. However, advocating for this change in population behavior is an impossible task for just 2 NCD technical officers in the Health Promotion Unit. Therefore, engaging regional colleagues, civil society organizations, and the private sector has proven beneficial in helping to advocate for healthy living here in St. Kitts and Nevis. One of our major partners in this endeavor is Lake Health and Wellbeing, an organization with leaders who understand the powerful form of health advocacy. Recognizing that advocacy is both a science and an art, Lake Health has systematically engaged in activities that articulate health issues in ways that inspire and motivate individuals to act. Their activities are current, relevant, and incorporate creativity to draw the public to their cause. This is evident in their successful You're Sweet Enough campaign, geared towards bringing awareness to the harmful impact of sugar-sweetened beverages on our health, and to advocate for the development of the National Sugar-Sweetened Beverage Policy. Now, they have partnered with the Health Foundation of Jamaica to bring their radio drama series Coming a This to St. Kitts and Nevis. This radio series explores several important health issues in a fun and engaging manner using radio drama. After listening to the first episode, I was left wanting to know what else would transpire in the lives of Angie and Jen. I believe that we are in a time when creative works can make a difference in helping to bring awareness to and fight against the growing burden of NCDs in our federation. With a little humor, we can bring awareness to the seriousness of NCDs and ultimately help someone to make the right decisions towards a healthier lifestyle. On behalf of the Ministry of Health, I extend our best wishes for the success of this radio series and the continued collaboration between Lake Health and Wellbeing and the Heart Foundation of Jamaica. Thank you.
Wonderful. Thank you so much, Dr. Carty, for your fantastic remarks, your insightful remarks, and giving us a bit of background. And also thank you so much for your well wishes, both for us and for the Heart Foundation of Jamaica. And it's always a pleasure to work with you. So thank you so much for your time today. So we're now going to move on. So next speaker is Kay Morrish-Cooke, the Communications Officer at the Heart Foundation of Jamaica. And Kay is going to give us a little bit of background into NCDs in Jamaica and also into the development of communities. So over to you, Kay. I'm going to get your slides up. Over to you. Okay. Sorry. All right, so I'm just going to share slides.
Okay then. Good afternoon, everybody. A warm Jamaica greeting to you all and all protocols observed. Well, we here at the Heart Foundation and the Global Health Advocacy Project would like to take this opportunity to just say thank you for allowing us to be a part of this wonderful adventure. And I'll just now give you a brief overview to what led us to create the series. So here goes. Next slide. All right. The Heart Foundation of Jamaica was formed as a non-governmental, non-profit organization in 1971 by the Lions Club of Kingston. And it is a member of the Inter-America Heart Foundation and the Framework Convention Alliance and the Healthy Caribbean Coalition and the World Heart Federation and the NCD Alliance. You can change. The foundation has as its mission to ensure that Jamaicans live a long and have a better quality of life through prevention and control of cardiovascular disease. And it has as its mission to promote a healthy lifestyle leading to the prevention of cardiovascular disease, promoting heart health in Jamaica through a myriad of services offered at the foundation, like screening and health education and training. Next. Now, the Global Health Advocacy Project is funded by Bloomberg Philanthropics, and it is housed within the Heart Foundation of Jamaica and has as its objective to increase public and policymaker awareness on the health impacts of, unhealthy foods and beverages, that is foods high in fat, sugars, salts, and to build support for obesity and non-communicable diseases prevention policies. And we partner with the Ministry of Health and Wellness, Jamaica Moves. We have 18 non-governmental organizations, which include faith-based civil society, medical, school, and government. And also the Caribbean Institute for Health Research. They provide all our research materials and support us that way. And we are also a member of the National Food Industry Task Force, which is part of the Ministry of Health and Wellness. And these are just our policy priorities, which is front of package labeling, school nutrition policy, restriction to marketing of unhealthy foods to children, and a sugar sweetened beverage tax. So now let's look at the Jamaican reality. Have a closer look at what exists in Jamaica in relations to NCDs. What we find is that 1 in 2 Jamaicans aged 15 and over overweight or obese. Increasing rates of obesity. We find that 1 in 3 of Jamaicans is hypertensive, 1 in 8 has diabetes, and 1 in 4 is unaware they're either hypertensive or have diabetes. And when we look at it, break it down further, we see that 62% of deaths, NCDs contribute to 62% of deaths among men and 74 among women. And this is taken from the Healthy Lifestyle Survey in 2016. Next. And that's reality. Over 500,000 Jamaicans are obese, which means 1 in 2 Jamaicans. Next. And again, over 684,000 Jamaicans are hypertensive, and 688 Jamaicans are pre-hypertensive. And when you look at the statistics for the diabetes, you find that close to 250,000 Jamaicans have diabetes, which roughly works out to 1 in 8, 9% for men, 14.6% for women. Now, in today's culture, it's becoming more and more difficult to maintain a healthy diet. People are working longer hours outside the home more than ever before. Demands of work, family activities, and other personal responsibilities leave many people reaching for quick and easy food options. And there's a high availability of low-cost foods and beverages that are also high in calories, fat, salt, and sugar. Nutritious foods are difficult to access for certain segments of the population. And you also have the very powerful food marketing that impacts and targets children. And the nutritional information is lacking or difficult to understand on products. You can change. All right, and currently we're just coming out of the COVID pandemic, but it has impacted upon the mental health, eating habit, and physical activity levels of Jamaicans. And as a result of the restrictions that were imposed upon, you find that consumption levels have increased in the types of food that were eaten. And due to the restriction and loss of loved ones or income, persons have turned to ultra-processed products and alcohol as coping mechanisms or comfort foods. And the result of that is weight gain, contributing to overweight and obesity. And a recently conducted study by Van der Rohe points out that during COVID, 87% of our population was less active, 62% changed their eating habits and the types of food that they consume, and 80% gained weight. Next. Next. You can change that. All right, we have the healthy eating tips which we embarked upon asking people to eat plenty of fruits, vegetables, to choose whole grain, to choose low-fat milk, and to choose lean meats, to try other sources of protein, to keep hydrated, to read food labels. Next. We also show them about the importance of exercise, how it just improve their overall well-being. Next. So now, how do we get all the messages that I've just spoken about out to the wider populace? We did it through public education and outreach activities to schools and community groups and churches. But we also found that we needed to reach a wider cross-section, hence the advent of communities. We recognized that such a method had the ability to influence health behaviors and promote health behavior change. We have successfully launched 2 seasons. Each season 13 consists of 13 episodes, and they have been aired over 5 of our radio stations here in Jamaica. Yeah. And this is our version of what Angie and Jen looks like when we do it on social media. Next. So the impact that we have found to date is that it was launched in 2020 and it reached 48%, or roughly 800,000 members of our population. And we have rebroadcast the radio series, and we saw the reach going to 35% of our population. Season 2 also ran for 13 weeks and reached approximately 600,000 members of the population. And you must note that the maximum radio reach attainable in Jamaican radio is 47%. So we think we did a very good job. Next. And the program has been noted to have significant reach and impact, and it has impacted public perception based on the feedback and support we have gotten. Jamaicans have discussed what they have heard, and they have used the interaction between Angie and Jen to validate their own experiences and expectations. Yeah. And this is some of our, the discussion around food labeling that happened between Angie and Jen. They want to know what is in your food, and Jen says, she reads the label. Angie says, she reads the label like it's a book. She takes it seriously. Next. So now the Heart Foundation is most proud to collaborate with Lake Health and Wellbeing in the launch of this such an impactful tool that we have found here in Jamaica. And we hope the experience has even greater impact on you. And as we continue to advocate be on this advocacy journey together. We also expect that citizens will enjoy the fun-filled and dramatic journey between these two friends in their quest for better health, and that people will relate to their experiences and in turn help guide health behaviors and advance policies that will help to develop a healthier nation. And lots of love. And I really looking forward to the feedback. And we also would love to hear from you. Thank you.
Well, thank you so much, Kay, for your comprehensive presentation, a really interesting look into the impact of NCDs in Jamaica. So thank you so much. Really appreciate it. So now what we're going to do is we're going to play the first episode of Come In At This, so the audience can listen to the episode and get a feel for what the series is going to be all about. So if you just give me a few minutes and I will get this. So now we're going to listen to so thank you so much, Kay. Sorry for your presentation. Really appreciate the comprehensive presentation and the comprehensive look at the impact of NCDs on the population in Jamaica, and also giving us a bit of background into why you developed Come In At This. So now what we're going to do is we're going to play the first episode of Come In At This so that the audience can get a feel for what the series is all about. And then we'll open up for some questions from the audience. Okay, so if you just give me a few minutes and I will get this up for everyone.
It's fun, it's drama, it's real, but you'll only find out if you come in at this, as neighbors Jen and Angie fight their way to a healthier life for themselves and their families. Brought to you by the Heart Foundation of Jamaica and Food Policy Program. So come in at this right now.
Hey dog, I be asleep in you there, pan. Jen, where you there, pan?
See me here. Might as well make your key for my house.
I know my father door open and your security dog asleep. How you cook, girl? It smell good.
Come out of my pot. It's pumpkin soup.
What, no little, no in it.
Eat no need it. Strictly healthy vegetable. That's how we like it. You want some?
No, sir. My own affair having little tail in there with fat on it. Well, and then I say nothing about my outfit.
Outfit is right. More you're out than in.
Well, I really take 2 sizes bigger, but them never have none. I just couldn't left it. Nice. Don't.
All you have to do now is trim down little and it will fit you good.
Excuse you? Me look good same way.
You look good, yes, but my girl, if you keep put on so much weight, little friend this year, so you have pressure, diabetes, or some heart problem or the other, your structure not gonna be able to manage it.
You're jealous. Everybody knows that Jamaican man love them curvy diva.
Well, my husband like him woman healthy, cause that means I'm a mental a fire as well as me physical. Plus me no pop down every minute.
How you call pop down?
Me never say you pop.
Just true. Me little bigger now, sake of COVID lockdown. You're going like your customs. I tax people for overweight.
You need to calm down.
Listen, not tell me for calm down. I come in here in a good mood, in my outfit.
Angie, it's just caution. Me I try caution you. If you gain too much weight, you can become obese.
No. Now get away there with me. If you cuss me, use words when me know.
I wasn't cussing. Listen to me. The doctor them have a way to check if your weight is right for you to be able to keep good health. What them do is, they measure your height and them say, well, for that height, you're supposed to weigh between this and that. If you're gone over that, then them say you're overweight or obese.
Then what the difference?
Obese just mean it gone bad. Neither of them is good.
You know what your problem is? Because you're a ward assistant, you think say you're a doctor.
Angie, me see with me own eye them what happen when people make them weight get out of hand.
So me now is out of hand.
You know what? You're right. It's your choice. Eat healthy and maintain a healthy weight, or continue to eat the whole heap of sweet something them where you sell, then get overweight and get sick.
You know, if I'm coming at your house, it just dip on me case. You know what? Me no need this.
Sometimes good advice is hard to take, but are the consequences for Angie's health worth it? Join us again next week as the drama continues on Coming at This, brought to you by the Heart Foundation of Jamaica and Food Policy Program. What's in our food? Give us the facts.
Welcome to the Coming at This episode summary brought to you by Lake Health and Wellbeing. In this first episode, we're introduced to Jen and Angie. Now, these two friends are close. Jen is a ward assistant at the public hospital, and Angie works as a local vendor. Jen and Angie are bantering, as friends do, and the conversation takes a turn to where Jen points out that Angie's gained a bit of weight. She's concerned over how Angie's weight gain could lead to health problems like high blood pressure, diabetes, or some sort of heart problem. Now, naturally, Angie starts to feel some type of way. After all, Jen basically called her fat. So she really gets defensive and blames COVID-19 lockdowns for her sudden weight gain. On the flip side though, Jen is really just trying to look out for her friend because as a ward assistant, she is all too familiar with patients who struggle with different illnesses and health problems as a result of their poor diets and lack of exercise that lead to being overweight or obese. Unfortunately though, from this encounter, Angie seems to be a bit too offended to really hear and understand what Jen is saying. Now, could Angie's response to her friend's health advice be you? Or maybe it's someone you know? Or perhaps how would you approach telling a friend to make healthier choices? Do you think Jen was right in her approach? Just think about it. To replay this episode and follow the other episodes in the Coming at This radio series and episode summaries, find us at youaresweetenough.com. Until next time.
Share some love, tell your body you're sweet enough. Drink some water, share some love, tell somebody you're sweet enough.
Okay, so that was episode 1 of Come In At This. So what we did at Lake Health and Wellbeing is we just added a little episode summary at the end. So now just open up for questions. So does anybody have any questions about the series and about any of the presentations from Dr. Carty and also from Kay? Any questions? Okay. No questions, no questions. Well, I will ask a quick question, Kay, if you don't mind. I'll ask you a very quick question. So I think, the series is really fantastic. It's really well done. And I think it might be something that other NGOs and maybe the Ministry of Health or whether in St. Kitts or other islands may want to use this type of series to communicate other messages, whether that's public health messages or other messages. And I'm just wondering if you have any tips or guidance that you can give other NGOs if they're trying to embark on developing a radio series like this. Any tips or guidance?
Tips and guidance. So we're an oral society, and that is how we communicate best. And what we did was to get an expert who could write and distill this information and make it into a format that could be used. So it takes good script writing to get the information out. I think that is the main thing, the scripting. I would have to keep that, as I keep saying, we have to keep it short and sweet. I would take just one topic per episode. You don't to try put 2, 3, 4, make the information just one. So it's easy to follow per episode.
Okay, wonderful. Thank you so much for that. Does anybody else have any questions that they might want to ask while we have Kay? Okay, we have a question from Francis. Go ahead, Francis.
Sorry, I don't have a question, but I do just want to express how much I enjoyed it. It just came across as really realistic and hit the tone right. And I think, like you say about the script writing was fantastic, and the delivery too. And it captivated my attention, and I wanted to hear it right till the end. And yeah, I really, really enjoyed it. I want to hear more. I want to hear how the story develops. So yeah, I really enjoyed it.
Wonderful, wonderful. Thank you so much, Fran. Any other questions? Does anybody have any other questions for Kay while we have her? No? Okay, well, I'm going to ask one more question then. So I'm going to ask a question just around the policymakers in Jamaica. How did they respond to the series? How did policymakers in Jamaica respond to the series?
To be quite honest, I'm not sure. I know that we have sent it out, and we have sent the links, and we have informed them that we are doing it. But basically, this really wasn't so much targeting the policymakers per se, but as a way of getting information out to the public at large about NCD, knowing their numbers and what they're supposed to do, and also showing them how they have a voice and how they can use their voice. Because as you listen to the episodes as they go on, you see how they become empowered and what they do.
Okay, wonderful. Thank you so much. Thank you. And I guess if there are no other questions, going once, twice, 3 times, any more questions for Kay? Yeah, any more questions? Okay, it doesn't look like we have any more questions. So I am just going to quickly wrap up. So with just thanking everyone. So I would just really like to say a big thank you to the Heart Foundation of Jamaica for partnering up with us on this project and to come in this to St. Kitts and Nevis. We really appreciate it. It's been a pleasure working with you all. Thank you, Kay, for your presentation today. It was really very comprehensive and really insightful, and it gave us really good information on the background to the radio series and why you decided to develop it. So we really thank you so much for your time today. Thank you, Dr. Carty, for your time. As always, it's such a pleasure working with you and your team. Thank you for the presentation and providing us with some background into how NCDs affects the population here in St. Kitts and Nevis. And we also appreciate your very kind words as well for both Lake Health and Wellbeing and for also the Heart Foundation of Jamaica. So thank you so much, Dr. Carty. Of course, I have to say a big thank you to Isoline Phillip, who prior to her wonderful role that she has right now, as the junior minister. Iceline was our senior advocacy officer, and she did an excellent job in this position. We really appreciate all that she did. And specifically when it came to come into this, Iceline worked really hard to kind of really distill the information from the episodes and to create some really good summaries at the end. So thank you so much, Iceline. We appreciate it. And really just thank you for your sort of insightful and thoughtful episode summaries. Really appreciate that. So thank you. Also like to thank the Global Health Advocacy Incubator for the continuous support and for facilitating this collaboration between ourselves and the Heart Foundation of Jamaica. Thank the focus group participants. So we did do a little focus group here in St. Kitts and Nevis, and we really appreciate those that attended and those who provided very useful feedback on the series. So thank you so much. We'd also like to thank our radio partners, Win FM and ZIZ, who I think are on the call today. So we thank you so much for your presence and for broadcasting the launch, but also we'd like to thank you for partnering with us to air the series once a week for the next 13 weeks. So in terms of next steps, people can hear Come In At This on Win FM Mondays at 11 a.m. from October 3rd, and ZIZ Radio Wednesdays at 1 p.m. From October the 5th. So we hope that everybody will tune in. Please do give us feedback. You can email any feedback that you have to info@lakehealthandwellbeing.com, but also the episodes will be on our website, which is yoursweetenough.com, and you can comment there as well and provide any feedback. So thank you to everyone. I hope I haven't forgotten anyone, but just thank you to everyone for today. And thank you to the Heart Foundation of Jamaica just for the opportunity to collaborate. So thank you so much.